Today we have Dr. Costa, Claudia Costa, or Claudia Costa from Brazil, Sao Paulo, Brazil. I'm so excited. I know you guys are excited. I had a lot of people reach out to me over the last few days saying, oh my gosh, this sounds so exciting. I've had veterinarians reach out to me. So people want to learn about this. And I'm thrilled you wanted to do this with me. So thank you, Dr. Costa. You have such a diverse background. You are like this weird mix of alternative and science, and it's just a wonderful blend of like holistic and clinical. And you have some books, you have a book, you're a published author, you have a new book coming out. You actually train veterinarians in mistletoe. So at the end, we'll make sure you guys know if you want to learn more about mistletoe therapy, how to do that or how to find a veterinarian. Maybe you can help us with that. Thank you for coming here today, Dr. Claudia.
Hi, Poppy, and hi, everybody. It's a pleasure to be here. I'm honored to receive this invitation from Poppy. And for me to talk about Mistletoe is the reason to be here. And I'm really happy to be here. Sorry. A bit nervous, maybe.
Maybe a little nervous. That's okay.
Nervous. Different from the other
the whole
meeting
reason
that we have.
The whole reason for this page is to empower pet owners and veterinarians on cancer options, canine cancer options, how to treat cancer, how to prevent cancer, cancer success stories, canine cancer success stories. I started doing this series because I really wanted to empower proactive pet owners, proactive dog lovers, to give them hope. And I've heard about mistletoe therapy. I actually looked into it when my own dog got a spinal cord tumor. It wasn't cancerous. It was benign. It didn't respond like any cancer. It was super frustrating. But I asked my veterinarian at the time, what about mistletoe? And he was like, whatever, you're going to have to go somewhere else for that. And I couldn't find anybody to do it. And I tried the homeopathic remedy Viscum, but it didn't seem to be profound. It's a strong remedy, I'll tell you that, but I can't wait to learn more about mistletoe. So how did you learn about this? How did you get started?
In 2007, I had a course for veterinarians in the Veterinary Association here in São Paulo, and I decided to teach homeopathy for them. I am in homeopathy since I was 5 years as a vet. When I was a vet for 5 years, I decided that I was not going to work anymore in the way that we used to do, because we only have anti-inflammatories and antibiotics. So for me, it wasn't enough. And I had a book, an old book of homeopathy. I didn't have ever taken any homeopathy remedy for me, but I decided to study this. And when I entered the school of homeopathy, I was really astonished. You know, it's a completely different way of thinking. And for me, in that time, make sense. And then I started using homeopathy with my animals, my patients. And one day I was a member of the Veterinary Society here in São Paulo. I decided to say, well, I want to give a course of homeopathy for veterinarians. And it was accepted. I was a member of the directory. And then we start with this. And a friend of mine, he was my, how can I say, we were together in this course. And he said, I know a doctor, a human doctor, and he works with Mistletoe. And I don't know what Mistletoe is. And then we invited this guy. He's very famous, a real good doctor, and he's anthroposophical doctor from anthroposophic medicine. And he gave us a class about Mistletoe. I was surprised, and my God, this is a plant that can treat cancer. and we have so many cancer patients, and we don't have anything to do with them. And I don't know if I told you, I have master degrees in medical clinic, but I studied immunology because I wanted to use homeopathy at the university, but I wasn't able there. So I was thinking about a plant that I could use for treating cancer, and I didn't have the tool. And this doctor, he's called Nilo Gardim. He's very famous here in São Paulo. And he took me to the Anthroposophical Association. And, come on, you can learn with the doctors. Although you are a veterinarian, you can come with us. And then I started studying with them, and I learned. And there was, at that time, Iscador from Veleda and Helixor from Helixor.
Okay, hold on. I'm going to stop you. So Iscador is a brand of mistletoe. So that's like a little vial. They sell it in vials.
Yes.
And Helixor?
Helixor is ampoules. Both are ampoules. They are in Germany. We have different companies that provide us with mistletoe. But the main are Veleda, and they used to have Iscador. Now, at this time, they are not together anymore. So Iscador is from Ischia in Switzerland. And Helixor is in the south of Germany, and they produce mistletoe. The mistletoe that I use, that I most use, because I used to use Iscador, I don't use anymore because we don't get Iscador here easily. And Helixor is now in Brazil through a pharmacy, and this pharmacy distributes Helixor in São Paulo, well, all around Brazil. So I use Helixor. But at that time, Helixor was giving some meetings in Germany, and then I went to Germany with the doctors, and I learned how to use, and I started using with my patients. And since from the beginning, I noticed the difference. When you give mistletoe to a patient who is developing a cancer, the first thing you listen from your client is, oh, he's eating again, or, oh, he's much more happy now. He started doing things that he didn't do anymore. So for me, it was really, wow, what is this? This is different. And then I started noticing some tumors that reduced in size, and other things like, for instance, if you have osteosarcoma, you know that if we don't do anything, we have 3 months, maybe 4. If you use chemo, 6, 7. And with mistletoe, without chemo, 5. But if you use chemo, and then you can use mistletoe and chemo together, you have sometimes 8, 9 months. So the animal lives more, you know? The life spreading is longer.
It also sounds like quality of life.
Yes, and you can notice an improvement in quality of life, and you make life longer. They live longer. I had a very beautiful experience. I think the dog died 1 month ago. This small Yorkshire had a melanoma here in the mouth. It was very terrible. Without chemo, without anything, the client decided he wouldn't do anything. And using mistletoe, this dog lived 9 months.
So that was the only thing he did. He didn't do homeopathy.
Yes.
Yeah.
Oh, yes. Always. I always use.
Yeah. Thank you. Homeopathy is a rock star, I have to say. And I love the fact that your whole alternative awareness started with homeopathy.
First of all, you can use mistletoe with any therapy that you want. I use Mistletoe with cannabis. I use Mistletoe with vitamin C. I use Mistletoe with melatonin, whatever you want to improve the cancer. And I feel, I don't say feel, I notice, it's just, I'm not naive. I know what I'm doing. So these animals live longer and in better conditions when you use Mistletoe, when you add Mistletoe. But I have some animals that I just use Mistletoe in the beginning. So I noticed the difference. And you talked about something very interesting. You talked about homeopathy, this Mistletoe. If you study Mistletoe and in Materia Medicas, you know, Materia Medicas,
Materia
you don't
Medica.
read that.
Yes.
Yes, Materia Medica. You don't read in anywhere that is made for cancer.
No.
Never. So that's why I was thinking, well, this is strange, because the homeopath doctors are always talking about Mistletoe, but where is Mistletoe for cancer? And I have many books about homeopathy. There's no place I searched it. But, you know, there was Hahnemann. Rudolf Steiner, that is the father of anthroposophic medicine.
Okay, wait. Go into
Yeah.
detail about what that is, because I'm sure our audience has never heard that
about
word.
this.
It's a brand new
So-
word for me too. So please
Okay,
go
I'll
into a little
explain.
detail. And you are amazing. Like, you have this clinical human side too. So you've been introduced to modern human medicine, holistic human medicine, and animal veterinarian medicine.
Since the beginning of my career, because, you know, I am a vet for 32 years. In the beginning, there's nowhere to go. We had to go to the doctors, to medicine, human medicine. We didn't have anything. And for instance, at that time, we only had 3 universities here in Brazil that teaches veterinarian. Now it's always spread. But at that time, I am someone that likes to read and to study. And I didn't find anything to study because there was only something like public health. I don't want to study public health. I like medicine. Then I went to homeopathy as maybe something that I could use in my patients. And when you think about homeopathy, homeopathy is in the end of the 19th century. 100 years later, there is Rudolf Steiner. He was in Germany and he was a thinker. He used to use gut observation. It's Goethean from Goethe, a philosopher in Germany. I think
Gut meaning gut health?
No, Goethe is Goethe.
Okay.
The philosopher.
Okay. Thank you.
So it's a way of thinking in science. When you observe phenomenon, it's phenomenology. And Rudolf Steiner was a man that studied this, and he developed his own system. And there are many. Have you ever heard about Waldorf school?
No.
It's a kind of how to teach children in a very natural way. And Rudolf Steiner, he met Dr. Ita Wegman. She was Dutch, and they developed anthroposophical medicine. It's a medicine of the spirit. They call this spiritual medicine. And then they together developed many different medicines for many different diseases, but they think in a very different way from now our medicine, normal medicine. And Rudolf Steiner used homeopathy. He knew homeopathy. There are many medicines in anthroposophical medicine that use homeopathy, but he went further, and then he noticed that Viscum album, observing the way the plant is, it's a parasitic plant.
It is a parasitic plant, and it is a toxin.
No, it's not a toxin.
It's not. I mean, like if I ate the plant, wouldn't it make me sick?
No.
Really?
Maybe, yes. But it doesn't make toxins. It's because the whole complex is toxic, You have many different substances that makes it toxic. Like if you have cannabis is toxic in this way, but you can use this as a medicine. You remember Paracelsus. Have you heard about Paracelsus?
No, wait, what is that? Sorry, I thought something else, and I was like, no, I don't think so. Wait, I want to talk about the actual plant, because
that's good.
In the materia medica, in modern herbalism,
you have to stop me, I go further.
we watch the nature of the plant. Like it grows as a parasite on the tree. It sucks the life out of the tree in a way, but it's very small.
It never touched the soil.
It never touches the soil.
Never.
And it's got the funny little beads on it, the berries.
The berries, for instance, you have the plant. It doesn't matter the plant. There is a bird that eats the fruit, and then he puts this seed on the plant, in this tree, and then on the branch of the tree. And then this seed sends it's called austorium. It penetrates the main tree, and then it goes inside there is siva, and then it's
into the bark, into the
yes.
whole like branch.
Yes. And then once it is inside, it sucks, the best from the tree. And if you have an apple tree or a pine tree or whatever, Abiatus tree, you have different kinds of Viscum album, Mistletoe, A, P, M, and these names are from the trees that they parasites, that's it. So, this plant.
Do you know why we use it for like Christmas to kiss people?
Yes.
Under? Like I always thought that was so weird. I'm like, why is there a toxic plant hanging that we kiss under? Do you know?
Mistletoe is known for ancient times, if you think about Celtic people, the Celts use Mistletoe as a panacea, when you use for whatever you decide to do, because they noticed that it was a medicinal plant. So since the Celtics, we have history from Mistletoe. I described this in the book. And even in the Northern mythology, they have Mistletoe. And there is a tradition that when a couple kisses under a branch of Mistletoe, they will be safe and protect. And they do this in Christmas time, because Mistletoe doesn't die in the winter time. All the other plants goes dried and ugly, and Mistletoe in the worst winter that you can imagine is green and beautifully living, because it parasites the tree. So this is analogy in cancer. You have a disease that eats from someone that hospedates this. This plant spread in a circular shape, goes like a cancer goes all around, and the patient getting more and more, sick and thin, and the plant growing. So it's an form analogy. This is get observation. And then Rudolf Steiner had this, wow, this plant is for cancer, for carcinomas, especially.
Okay.
That's what,
So there's different types of cancers, but the ones that
Yes.
behave like the plant, the carcinomas,
that
is
was the first observation. Rudolf Steiner said that, but it was in the beginning of last century. Now we have 100 of years using Mistletoe in Europe, and we have many literature, scientific literature, proving and testing that Mistletoe can be used in whichever tumor you have. And it's not only for tumors. You can use Mistletoe for instance, inflammatory diseases like arthritis and, for instance, how can I say, lupus, autoimmune diseases.
Interesting.
So it's we don't know anything. We have to study this plant. We have to go further because we have many ways of using this. Chinese people are trying to use this for diabetes. For you notice, for instance, that it reduces alkaline phosphatases, hepatic enzymes. So it's very, very interesting. And the way it works, it's great because it improves the immune system and helps to kill the cancer cell. It's very interesting.
So it causes apoptosis.
Yes.
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 And it works on the metabolic system too, it sounds like. If they're exploring it for diabetes, any sort of like inflammatory response.
Yes, it's linked to inflammatory response. When you give Mistletoe for an animal or for a person, because all this start with people and not with animals, we have very few publications in animals. We have much more in people. So if you go to PubMed on Google, academic Google, you can find more than 300,000 publications.
Wow.
So yes.
So you wouldn't, Dr. Claudia, you would not just like go cut it off a plant in the wilderness and eat it. The stuff that you're using is already scientifically processed and it comes in vials. How do you administer it? Do you like inject it? Is it an IV?
So you can have, if you go to look after Mistletoe, you are going to find this as tea, as tincture, as globally, as homeopathic technique. You can find many differences. The ones that really works, in my experience, and what you can have scientific tests and research is the one that's made in anthroposophical technique, it's very well established. So they get the tree, all the parts of the plant. So you have leaves, you have the branches, and you have the fruit all together.
But there's not really roots.
No roots.
There's no roots. That's so wild.
Yes, that's what makes Mistletoe so special. And when they go to the tree to get Mistletoe leaves, fruits, and branches, if it goes down and touches the soil, you don't use this. So there is a special way with baskets that they take care and very gentle to get the plant, and they mixed. The harvest is in winter, in summertime, and I don't remember It's they call this Saint Michael's, I think, times. There are 4 times in the year that they go to harvest all the plant, and then they have a special machine to produce the liquid, and there is a special technique, and then they put in small samples, and then we use this. This is the fresh extract of the plant. It's not homeopathy. When you use homeopathy, and we have Viscon album or Mistletoe homeopathic, it's different. It's D4, D6, D9, it's and so on. But the one that really proves to be interesting is the homeopathy. It's the anthroposophical, and then it is in myograms. So 1 myogram, 20 myograms, 100 myograms of this extract, the fresh extract.
So that is the dosaging, like milligrams.
Yes, we dosage them in myograms.
Okay.
The dosage is myograms.
Can you use it as a prophylactic? Sorry.
Normally, yes. I have heard that there are some doctors that use themselves just to improve immune system. You can use this to improve system. So if you have, for instance, a cat with bowel disease, inflammatory bowel disease, you know that inflammatory bowel disease can turn into a lymphoma, intestinal lymphoma. So if you use Mistletoe, you are preventing from lymphoma. So this is a way you can use. You can use in cats with infectious peritonitis. You know, peritonitis?
Peritonitis, yes.
Peritonitis. So you keep the immune system very active, working. And so there are many different uses. You can use when you have, for instance, cystitis, recurrent with cystitis, all the time having bladder problems. So you can use whenever you want to improve. I'll give you an example. 3 weeks ago, a patient came to me with some wounds, and I made a culture, and it was a real difficult bacteria and not responsive to many antibiotics. And she was using a very difficult, very hard antibiotics, if I can say this in English. And it was not responsive. And I start with Mistletoe just once a week.
Oh, so you don't do it daily. You're not doing like daily injections.
No,
so
it depends on the protocol. You can, normally for cancer, you use 2-3 times a week. For improving immune system, just once a week.
Interesting. So you had a super bug. This individual had overrun all the antibiotics and has created a super bug. And you use the Mistletoe for
this dog was on a super antibiotic, but you know, the wound was there. And then I start Mistletoe with 3 ampoules. It's all closed. He came to me yesterday and I said, just keep Mistletoe for 2 or 3 weeks and then stop. He doesn't need it anymore. And everybody was, nothing could close this wound. And now it's okay. So it improves. It's not magical. It's just because it improves. It makes, you know, the leukocytes numbers increase.
Leukocytes.
It's known.
Yes.
It works with Th1 and Th2 responses, immune responses. It improves, you know, natural killers. So it's very interesting the way, and it produces fever. When you produce fever, all, you know, the inflammatory system is activated.
Thank you for bringing that up, because in modern medicine, They want to stop a fever, but the fever is actually the body doing its job. Unless
That's it.
unless it gets too astronomical where it could kill the host, right? But so mistletoe will actually induce a little bit of a fever to attack whatever's going on.
Yes. When
Wow.
you have an inflammatory process, Mistletoe will be very useful, very, very useful, you know. It's not, as I always say, this is not magic. I'm not sure if I wasn't using the antibiotic, this wound would close. But at the moment that I put Mistletoe, everything was activated. And when you think about homeopathy, we know the homeopathy remedy works in the vital force, right? So
Right.
it activates your vital force for living. And anthroposophical medicine works in this way because it's, you know, it works on your body, in the physical body. It works in the, how can I say this? In your etheric body and your mental body, and then in your spiritual body, because it's spiritual medicine. This is a different, very different way of thinking. When you think that the disease is not only on your body, the disease can be born on your feelings. It can be born due to your mental activity and spiritual as well. Of course, animals may be a bit different from people, but you know, human beings have a very particular way of living. But these animals are linked to us and they get ill as us. So why not use this kind of medicine for animals? And I went through this, all this, and started using and having better and better results. All my clients, not all, but most of them always say, Claudia, can you see, he was like this, he wasn't eating, he was, you know, miserable, and now he's playing. Although he has a cancer, but he's living. He's having better conditions, you know, to go on with this disease. That's it.
Dr. Claudia, have you seen it actually cure cancer or just suppress it?
Cured, yes. I believe it was cured.
And I've heard human stories about being cured
Yeah.
or in a combination with mistletoe and other therapies, people be cured of like breast cancer and things like that.
I really think that to be cured, it it needs much more than a medicine, you know. I believe in different things. I think the universe, you have permission or not to be cured.
So
you can see, let's think about
I'm a
people.
little confused. I'm a little confused with that. I think, are you saying that the universe decides it, or does the human psyche? Like, I know I was really critically ill at one point and I chose life. I actually said, I choose life. And that's when I started getting better. Is I made an audible choice. I actually said it out loud and things started changing at that moment. So
I believe.
Having a will to live, is that what you're talking about?
I think we have two choices when we are talking a very important disease. When you have very difficult situations or health situations, you have two learnings. Or you go from superation, like you are telling me, you decided, no, I want to I want to leave, and here I am to go this. This is superation. You are allowed, you know, but sometimes you are not allowed. Sometimes you die. And then you have to learn acceptance. And but this is very philosophical. That's the way I think things. But you know, I'm not an ordinary veterinarian. I have all my another way that I am searching, and this is not Mistletoe, because Mistletoe, although it has this philosophical and spiritual way of thinking, I have proofs. I have scientific research on this, and there are many researchers and people publishing about Mistletoe in Germany, and we have researchers in China, we have in Africa, because we have an African Mistletoe, and it's interesting for the liver. So we have some plants that are similar to Mistletoe, and we can use this to activate Mistletoe as well. And we have here a pharmacy in Brazil that is owned by a couple, and this couple goes on traveling all around the world to find plants. They have a very good botanical knowledge, and they make some remedies of plants that makes Mistletoe. It's crazy.
That's amazing. So they're literally real pharmacists.
Real pharmacists, as they are getting old.
Base.
That's just, I always say we are going to miss these people, because people knows a lot. And
I mean, that's what it used to be long before antibiotics. That was the original plant-based medicines. And lots of chemo is plant-based.
Yeah, everything is plant-based, if you think, or it's plant, or it's animal, or it's mineral.
Exactly.
It's something that has to be in our world, on planet Earth. Otherwise, you know?
Yes. And that's really an important part.
Sorry?
I think it's really important for people to understand that the origin of everything is nature. Something in nature. But we've polluted it to market it. So I have a question. Do you ever use topical mistletoe? Like the dog with the big open wound, would you make a mistletoe paste? Would you use it like bloodroot or neoplasm or something like that?
It's funny that you are asking me this, because I'm trying to find something like this. And in the last 3 weeks, I have a girl who works with me with soaps and conditioners and some paste for ears. I developed some products to sell in my practice for the animals that has no parabens and all this stuff, very vegan things. And then I decided, let's do something with cannabis, and why not Mistletoe? And then I started researching. I only found a paste from Veleda in Germany, and a gel, gel, jelly thing I'm not sure if it's in Italy or Switzerland. So I was asking why we can do this. This is because lectins, that are the main substances in Mistletoe, they are very label. They don't stand, heating, oxygen. They degrade very easily. So I'm not sure. I tried to make this with a pharmacist, Dr. Daniel Magano, who I works with him. He works for a pharmacy that imports Helixor, and we are always talking about this. We give the classes for the veterinary students together, and we were trying to make something topic. I would like to try in skin tumors.
Yeah,
see what happens.
So that was my thought too. So is there an oil to it?
No.
There's no natural oil to mistletoe?
There is tincture in
Sure.
water.
What do they mix the tincture with? Is it an alcohol or a glyceride or?
The ones that we use to inject is water, only water, nothing else.
Interesting.
But I have found in alcoholic tinctures, but you can make something like tea, but it's not stable. So you lose the lectins. If you lose the lectins, the properties are gone.
There's
You
got
need
to
the
be some
lectins
way to
and the
capture that.
yes.
Yeah.
But this is chemical. Then I don't know how to explain exactly. But what I can say is the lectins, that is the most important part of the plant, and you cannot separate lectins, viscotoxins, and terpenes, and whatever. It doesn't work the same way. It's like cannabis. When you use together, it's better. So we use always the whole extract.
Good to know. And
It
I think
results
that's the beauty of nature, and the difference between pharmacology and nature is nature has the whole chemistry, and then we'll like isolate cannabis or cannabinoids or curcumin or something like that, but it's not always bioavailable without the whole plant.
yeah, that's it.
Absolutely.
It's true.
And so are you IVing this, or is it is there an oral way to administer?
The way I use this subcutaneous injections, intratumoral injections,
Into the
IV
tumor itself?
in
Like
the tumor.
okay.
You can use this into the tumor. Although for me it's not a good way, I prefer subcutaneously or intravenous IV. And you can, for instance, you can use, if you have a bladder carcinoma, you can use inside the bladder, and it's great. I have a good result. And that's it. You can use in pleura, you can use intra-abdominal, depends on your heart.
Inhalation for like a lung issue?
No,
no inhalation.
no. I have never read anything about inhalations. Never.
And when you have a patient come in that's immune compromised, that's really kind of struggling to like chronic issues all the time, would you first go to mistletoe before you would go to conventional?
Before you go to, I didn't hear.
Conventional methods like
Conventional.
antibiotics. I just feel like, why not just go to mistletoe?
Yeah, I understand what you're questioning, because I think it's much better to add Mistletoe and not, I don't say no to conventional medicine. Never, never. Our basis as doctors, and we have some vets here, our base, unfortunately or fortunately, I don't know, is the exams, and the way we think is, it's conventional. But I can't say, sometimes it's not enough, because we know the forces of the integrative medicine, sometimes they are not enough. It's difficult to control pain with homeopathy. Although I love homeopathy, but sometimes you need morphine. So I think to be a good doctor, you have to use all the tools. So you have to make good use. I can't say corticosteroids are not okay, because they are okay when you know how to use this properly. It's easy like this. Of course, when you are a young doctor, you don't realize all the way you can use everything. But as you get older and you have more practice, you can see when you have to use corticosteroids or when you go to acupuncture, and maybe you need both. So I think it's the middle way, always the middle, to make good choices for your patient. And it depends a lot on the kind of the tutor you have. Sometimes the tutor, the person who is responsible for this animal, is okay to use this there are people that don't, or they can't afford, or they don't have time, or they don't have patience. So I think you have to choose wisely, all the time, wisely.
Okay, so what wouldn't you use mistletoe for? Have you seen harm from it?
When I wouldn't use mistletoe, I have been asked about this week. A vet asked me about. I don't remember what it was. She asked me. I said, "No way, it doesn't. If it's not inflammatory, mistletoe will not work because the basis for this is inflammation. No, if it's not
Okay.
inflammatory."
And
There's something very interesting. These animals get very, they feel better. And when you take mistletoe out, if they have problems with arthritis, arthrosis, or whatever, we start feeling pain. So my clients ask, please, can we continue mistletoe? Although we don't have the tumor anymore, can we continue? Oh, yes, it's okay. And they go on mistletoe.
so it's not toxic. You can stay on it for a while. Or is
No.
there a limit? Like, would you do it for years, or would you do it for like 3 months, give it a break?
No. Well, I will give you an example. If you have mastocytomas, it's the most common tumors in veterinarian.
Wait,
If
what
I
is
have
that?
mastocytomas,
Mastocytosis.
from mastocytomas.
That would be memory.
Sorry,
What is that?
masto, MASTO.
Okay.
CYTOMA. It's the most common tumor in veterinary science. Mast cell. Thank you, Janice.
Oh, mast cell.
Mast
Thank
cell.
you.
Yes, we call mastocytomas. You can find mastocytomas or mast cells. They are the most common tumors we have in veterinary. Normally, I make the surgery. When the surgery is possible, I always make the surgery, because you have to think that the tumor, it's like an antigen. So if I have something that I have to organize, that is the immune system, if I don't have the tumor, it's easier, to make this organization. So if I have a mast cell tumor, I take this out in surgery, and then I start mistletoe therapy. Sometimes I go treat, if it's okay and we don't have lung problems and the animal is okay. 3 months, sometimes 6 months in mistletoe therapy. Then I stop. It's okay. And most of the times that I use mistletoe with mast cells tumors, it never come back.
That's amazing.
Never come. It's difficult for me to find mast cell recurrency when I use mistletoe. For me, it's amazing.
So it is a histamine too. So if you have an animal with lots of allergies, it might be, if their allergies are through the roof, it might be a consideration.
No, because I have tried many times with allergy process, but we have to understand that mistletoe works more in Th1 response, and allergies are Th2 responses.
Okay.
So it doesn't work so good. It can help, but it's, for me, in atopias and all these problems, skin problems, I don't think it's very, very good.
Interesting. But that's
my experience
impressive on mast cell. That's
mast cell, it's great.
Yeah, that's so
it's
impressive.
great. Yes. And the problem is, most of the time, the clients try to find me in the internet. And when they come to me, the tumor is too big. We have metastasis, and then it's difficult to come back, to go back and see, oh, okay, the animal is okay again. What I can say, and another thing is that is important, when he dies, the death is easier. It's funny, and it looks strange, but what I feel, and then I say in my senses, they die more calm, and we don't have to make euthanasias most of the times. Of course, it's not always. If you have osteosarcomas, and there are, unfortunately, there are tumors that are very aggressive. But even though, the way you go with your client is better. And what I notice is the family gets involved with the problem. And this for the animal is great. He's not alone, because everybody in the family, everybody's concerned and involved. So someone has to keep the dog, the other one has to apply the injection. So it makes everybody working together for a good response. And this is systemic, like we talked last
Monday. I know, it feels like weeks ago, actually.
Yeah.
So Dr. Costa was on the Holistic Animal Insights membership page on Monday and shared about the animal-human bond and how humans and animals might transfer illness or share illnesses. It was super fascinating, and you guys can catch that replay on YouTube. And so how expensive is treatment?
That's a good question. For us, buying in Brazil, it's about, let me think, 100 per month.
That's
$100 or $200 per month.
And that's in American dollars?
In American dollars, depending on the dog, from $100 to $200. Let me say, the standard therapy, subcutaneously. When you use IV, you inject more than 1 milligram. You go to 100 milligrams, then it gets expensive. But we can use, it's not that much. I think the price is more or less the same in Germany, and in United States we have Uriel Pharmacy. They provide us with Mistletoe. I have had some American people calling me, and I treated online, and they always buy from Uriel. Uriel is great, helps us a lot.
That's awesome.
And they have anthroposophical medicine, lots of anthroposophical medicine.
So if veterinarians wanted to learn, they can contact you directly. Or is there an association? Is there like a Mistletoe Veterinarian Association?
No.
No.
I think there are very few vets that know how to work with Mistletoe. Here in Brazil, there's me and other 2 or 3 vets that are teachers of Mistletoe. The only one that works with Helixer, it's me. And as I told you, I will have my book published. So I think until the end of July, we will have this in Hotmart platform, and it will be ebook in English.
That's super exciting. Well, let us know when your book comes out. We'll announce it.
Yeah.
And
Okay,
put a link on how to buy it and all of that. Any other cases that you want to share with us? I'm super blown away by the mast cell. So anything else we should consider mistletoe for if we're fighting cancer and you want maybe a stage 1 or 2, not necessarily a stage 3 or 4?
You can use Mistletoe in the stage 1, 2, 3, or 4.
Okay.
You can use for treatment. You can use for palliative concerns. You can use this to activate immune system. You can use in many ways. When I teach all the ways, and how you use and you improve immune system with Mistletoe, and the action of the apoptosis action that I think it's the most interesting for us when we want to kill a tumor. And I think Mistletoe is an additive therapy. So most of my cases now, I use homeopathy, I use Mistletoe, I use cannabis, I use whatever I think it's important for that dog. And it's great. I really like, I'm very grateful for this opportunity that I received from learning, because nobody used to, no vets were used to Mistletoe. And then I decided, oh, let me see, how can I use this? And that was great.
And Bronwyn is saying that she actually, her dog was getting sub-Q, or maybe she was getting sub-Q injections of Viscum, and it was very reasonable. So that's awesome.
Yeah.
Around the same cost as was mentioned. That's awesome. That's so, I mean, I know what I paid to try to do life-saving tactics for my dog, and $100 a month or $100 even a treatment would have been way more reasonable for me than what I was paying for.
They say that more than 70% of people in Germany, when they have cancer, they use Mistletoe.
70%?
Yeah, that's very, very popular in Germany.
Isn't that amazing?
Yeah. What I think, what is strange is why it doesn't come to us. It doesn't spread, because it's very, very interesting, you know? I don't know if it's the industry or if there's a way of, you know, keeping this there. I don't know.
That's what I'm wondering. I'm like, oh.
I don't know. Now it's becoming more, you know, famous. I'm going to a congress in Quito, in Ecuador, next month, and there will be a conference for Mistletoe, and we are going to see. But you know, the pandemics made this a problem it was problem for everybody, but now it's getting more used, more known. And what I see, the internet is helping us to spread this knowledge a lot.
Absolutely. Absolutely. I've known about it for years in the human space. Like I said, I fought for my dog to get it when he had that spinal cord tumor. I couldn't find anybody in California that actually did that at the time. And that was probably 5 or 6 years ago. It wasn't that long ago. So information being shared, like platforms like this, will help empower and get the pet parent asking those questions to their veterinarian, and hopefully their vets are on board with fighting the good fight, especially if you're getting results like you are.
Yes.
Is there anything else you want to share with us today that would just like empower pet owners?
To improve, to improve pet owners, yes, I would say, you know, I think the most important thing when you are treating animals is love. When you dedicate, you know, love, and you are at service, you know, when you feel that, you know, we are not here in this universe for no reason. We have reasons. And sometimes, you know, someone that thinks, oh, it's okay, but the only thing I have is this dog, and it's my life. So go after this. And I think for me, is dedication, is to serve. So if you want to help your dog, it's love. It's go for this. It's very simple. It doesn't matter if it's a plant, if it's a child, or if it's an animal. It's love. It's pure love.
Julianne Lee talks about that too, is love is powerful medicine.
Yeah.
And the oxytocin, just the chemistry of it, but also the will to live when you're surrounded by loved ones.
When you are connected, you know, and when you, you know, when you are in a meditative level and you are connected, everything that you do, it's not yours. It comes from another plan, on another level. Then you make it in a good way. If you are doing with selfish reasons, then it doesn't work. That's it. This is very, very simple.
So I have a saying that says, question your motives.
Yeah.
And
Perfect.
so I will ask my clients, my friends, the pet owners, what's your motive here? What's your goal? What's your motive and why?
That's it.
And assess from that. So if it is a selfish reason, it could fail. Also, I'm noticed, and I wanted to bring this up on Monday, and I totally forgot, is often I will see the human taking supplements that the animal would also benefit from, or they're giving the animal supplements that the human actually needs. And I'll see this bizarre relationship between
Yes.
like, oh, that would have cured that animal or helped that animal. And we never even considered giving it, but the owner had it in the fridge and at arm's length, taking it themselves. So there's a weird connection about us grabbing what we need or our pets need, but applying it in the wrong direction.
That's it.
It's so strange.
It's, yes, but we talked about this last Monday. Yeah, it's a connection. So it's like Genesis said, resonance.
Resonance.
Yeah,
Resonance
and I
is a
think,
powerful word.
yeah, and I think for me we have allowance. For me, it's very easy to understand. It's the universe allowance. I think now, for many motives, now people are looking after better ways to treat themselves. I think conventional medicine, it's necessary. Otherwise, we wouldn't be here now. So we have vaccines, we have all the treatment, antibiotics. Everybody here had some throat ache or whatever. So infections, we need this. But now, especially now, that, look, it's popping, all around the world, many different ways, in natural ways, and people are looking for a better way of living. Sometimes I get, it's embarrassing, but, I studied astrology. I love astrology. And when you study astrology, and if you study anthroposophical medicine, you are going to learn astrology, because astrology in anthroposophic medicine is very, very important. When you think about astrology, we have cycles. So now, I think in 2025, Pluto is going to Aquarius. So everything is going to change, because Aquarius looks further. It's Aquarius era, so it's natural, and it's for the community. The knowledge must go to everybody. It won't be keep just for groups anymore. The things are going to be more equal. We can't see what we see in this world. So few people with so much money and loads of people suffering misery. Come on, we have to change this. So if you improve health in cheap ways, you can afford for this. This is the way of treating ourselves, because we are a community living in the same world. Many years ago, what happened in China doesn't get to us here in the Western, but now a disease there came to us. So everybody was ill at the same time. We are all together. So for me, it's clear. I am in the South America, in São Paulo, talking to you in America. This is, so
it's an
this is a
interesting
plant. Look, this is a plant in Germany that a South American learned about, and now this South American is talking about this to America. Come on, we are all linked. We are all together.
It's beautiful. It really is beautiful. And if a virus can spread like that, why can't love?
Love first knowledge, because I don't think that, we can't love if we don't know. We have to know ourselves first to love the other. So what we are doing here is knowing something that can help animals. It doesn't matter if it's Mistletoe, cannabis, whatever, it doesn't matter. There are many people doing the same with different drugs and other things all together at the same time. For me, it's the beauty of the internet, we are all linked together. We can talk now like this in the same level. I think this is, it doesn't matter where you are, who you are, how much you earn, your skin color doesn't matter. What matters? To stay alive. It's a privilege to be alive. And people, I don't know what happens. It's a privilege to be here now, learning, talking, to meeting people. This is privilege,
It's a gift.
Gift.
Yeah, and I think the last few years have really driven that point home is, yes, life
I think
is precious.
the time is coming, and it's having an opening now.
An awakening.
Awakening and
or an awareness.
It was everything was closed. Nobody shared, Now, okay, everybody can talk now. I can say whatever I want. And then you find your tribe, of course.
Yeah. And
here
that is the
we are
beauty.
the integrative tribe for vets.
Yeah. And that is the beauty that COVID actually did for us.
Yeah.
It's put us all on a platform that we can communicate across the world all at once and have these open conversations unless we get shut down. But
yeah,
yes, it's beautiful. Dr. Claudia, thank you for your time. How do people get in touch with you?
You can go to my website. I think it's better to write down because it's in Portuguese.
Send it to me and I'll put it on the live.
Okay.
Feed. You're also in the group, so you can share all your information.
Thank you. Thank you, Poppy. Thank you. It's easier. But, and then you can ask me on WhatsApp. For me, WhatsApp, it's easy. Whatever. There are some people that send emails. Sometimes I take time, but if it's WhatsApp, as soon as I can, I answer, and I'm open to help anybody who wants. Dr. Jill and I, we want to make a course for veterinarians to learn how to use Mistletoe. If it's not in the next semester, in the beginning of 2024, and maybe on Zoom platform, that it will be easier. There will be the book, and then I will let you know. And then we talk about this. And I hope I can meet some vets at the conference in October. I hope I can be in San Diego.
AHVMA conference, which is in San Diego this year, you guys, and anybody can go. You just purchase the ticket. You don't have to be a veterinarian to go. And there's some excellent guest speakers. And who doesn't love San Diego? Now, the people on the Zoom call are from my membership. If you guys have questions, feel free to ask them before we bounce off this platform. I know there's like 5 of you, I think. So if any of you have questions, feel free to unmute, turn your videos on, and jump back on. We'll give you a minute. Or post it in the chat. And Janice, thank you for your comments. I was struggling on that mast cell. I was like, what?
Anytime. Claudia, are you familiar with Viscum album in a gemotherapy remedy?
In a what?
Gemotherapy remedy?
That would be
no, I'm not familiar.
Yeah,
No.
phytoembryonic.
Yeah, they take
the
they take the meristem cells of the meristem cells of the mistletoe buds and shoots and make a tincture out of them, like they do with other plants, and they have a very strong affinity. I'm just reading it now to see. It is suggested for use with chemotherapy for the treatment of cancer, but not without chemotherapy.
I never recommend to stop chemotherapy, and you use Mistletoe all the time because it diminishes the bad effects of chemotherapy and radiotherapy.
Yes, that's what this is used for, is to diminish the effects of chemotherapy. Yes.
Yes,
Excellent.
it.
Good to know. Thank
it's
you for
one
sharing.
of the reasons I use this.
Whoops. And radiation.
Yeah.
So that's excellent to know if you have to go that route.
Yes.
And so if people want to use it, they can talk to their vet and tell it and share your information with their veterinarian, and their vet can contact you for more.
Yes, of course.
Okay. Excellent.
course.
Anybody else on the Zoom call that wants to pipe in there and chat? And you also said it's safe for horses, which I thought I was shocked with. Well, if it's good for cats, I was shocked about that too.
Yeah, using cats.
That's amazing. And so horses, I've never seen Viscum or mistletoe
Yes.
used in horses.
Yes.
I would love to know more about that. Not on this.
Yeah, and I'm not very familiar with horses. I don't work with horses, but there is I think it's a Swiss article in the beginning of the 70s or 80s about tumors in horses using Mistletoe. It was one of the firsts in veterinarian area.
Wow. I can't wait to look into
I will
that.
send to you. I sent to Jill. I will send to you.
Thank you. I appreciate that. You guys,
Yeah.
this has been amazing. Thank you for joining us. And if you have more questions, just put it in the chat and we'll check the chat out later. I will download this also and put it on the YouTube channel. So if you want to replay it and watch it from your TV, you can do it like that. Dr. Claudia, I am so grateful for your time today. Thank you.
Thank you very much for the opportunity. It's a pleasure to talk to you. And I hope we can spread together, Mistletoe, or wherever we go, we can find Mistletoe. It will be good. It's nice.
I can't wait to try it. Thank you.
Thank
Bye,
you
guys.
very much for everybody. Bye.